hints that someone...
The red flags in pregnancy. Red flags are the things that when you see them, you know that this might not be abnormal. Okay? There are some things that are not red flag. For example, a woman might stay and see that her legs are swollen. It is not a red flag because it might just be there causing no problem. By red flag, we mean those things that when you see, you don't have to wait for your husband to come back. You start going to the hospital, then you call your husband to meet you in the hospital. The easiest way you can get to the hospital and the closest one you can get to is where you will go to. And those red flags actually depends on the age of the pregnancy. But there are some red flags that cut across all the stages of pregnancy. One of the red flags are bleeding. Whether the bleeding is coming in clots, whether the bleeding is coming in small. Once you see bleeding in pregnancy, it is what? A red flag. Is it clear? Now, but the interpretation you give to that bleeding at the starting of pregnancy is not the same interpretation you will give to it at the end of pregnancy. Now, if a woman is like 1 month pregnant and she suddenly starts seeing blood, sometimes in that early stage of pregnancy, 2 things are involved, or 3 things rather. The woman might be dealing with implantation bleed. It might be a normal thing, just that the baby want to implant. So that one is implantation bleeding. It doesn't need any issue. Secondly, is that the woman might be having threatened miscarriage. On the third note is that the woman might have actually had a miscarriage. In that case, we are dealing with return product. Apart from the bleeding, that is not as important as when this bleeding is occurring at the end of the pregnancy, maybe at 7 months, 8 months, and 9 months. So by the time it comes, sometimes when the pregnancy is too young and the woman comes with mild spotting, there might be some time you even tell her, don't do anything. Just go and stay on bed, rest. You can give few drugs to avoid miscarriage. But sometimes at that a very much early stage, we might not even tell the woman to go to scan. Yes, if you go to scan, you will be sure what you are dealing with. But when the pregnancy is too young, when perhaps you might not be thinking of anything, once you see that bleeding, you can tell the woman to stay on bed rest, give her some drug, provided that there is no undue pain. If there are severe pain and you are seeing small bleeding, that one can even be more dangerous in the first trimester.